What's going on, everyone? Welcome to today's pandemic update for Monday, May 8th, 2023. You notice today I am not masking because the COVID threat in my household, for this time being, has finally passed. I am twice negative. I never did test positive for COVID. However, a family member who returned from traveling did test positive prior to returning from traveling. It's a long story. I don't want to get into it, but prior to returning from traveling, tested positive, and unfortunately, yeah, I did not know about it. I was not informed of it until they returned home and found out. Oh, by the way, I have to quarantine in my room because I have COVID. Like, oh, okay. So now you know the story of what happened. I'm not going to tell the full story, but you know what happened, and luckily I avoided it. Praise the Lord, knock on wood, this go round I avoided it. Let's get into today's pandemic update. And remember, folks, masking is still very important. I returned to work this morning, and I did mask everywhere I went. As you know, I do delivery apps. So every place I picked up at, I like to do the mornings into the lunch rush, because first thing in the morning, places are less busier than they are at dinner rush, which obviously it's a better time to be out at dinner rush, but it's not as safe at dinner rush because places are packed with people. Anywho, let's get on with today's update. India reports another 1,839 fresh cases of COVID in 24 hours. They also added 11 more deaths. Moving on to our next story. And this is something you're going to probably hear me talk about a lot because I'm getting pretty concerned about monkeypox. And I think we're headed for a repeat of what we saw last year, where we're going to see a summer season wave. As we know, the COVID pandemic, people who have caught coronavirus, their immunity is not as great as it used to be. Some people have severely damaged immunity. Therefore, it's allowing these other viruses of the past to resurgence and spread. Monkeypox is one of them. We've added another country into the mix. South Korea has reported 16 new monkeypox cases on Monday, today, May 8th, 2023. Their country's total is now up to 60. I believe this is the first batch of cases they've reported this year, but they do have 47 cases, with the first one being June of last year, June of 2022. And that news agency is, it's a Korean news agency, Yonhap News Agency, and they do say 16 of the cases were Korean, or excuse me, yeah, out of the 16, 14 were Korean, and 2 were foreigners who tested positive. Moving on to our next story, secondary bacterial pneumonia drove many COVID-19 deaths. So people who had secondary infections directly after coronavirus, many people did not survive it, and it was a high number of deaths. And if you want to read this, I will share this link to this on my Twitter page for you to read. And I think someone else tweeted out. I might be able to retweet it from them. All right, moving on to this from CNN. And this is relatively concerning because we're starting to see this pop up in other countries as well. Doctors watching for more cases after mysterious cluster of brain infections strikes kids in southern Nevada. And this is something, I believe last week, I might have tweeted on it, don't remember if I did or not. It's also happening in the UK. CNN says, disease detectives with the Centers for Disease Control and Prevention are investigating a cluster of rare and serious brain abscess in kids and around Las Vegas, Nevada. And doctors from other parts of the country say they may be seeing a rise in cases as well. So this is relatively concerning. And it says here, in 2022, the number of brain abscesses in kids tripled in Nevada, rising from an average of 4 to 5 a year to 18. You gotta wonder if any of this has to do with the COVID pandemic, with people catching COVID and their immunity being messed up. And remember, we do know COVID can impact the brain. All right, another mysterious report. Texas family searching for answers after unknown illness paralyzes young father within days. So a young father had an unknown illness, and then they ended up having paralyzed. I mean, read this. Last week, Austin Aragon was in perfect health. He enjoyed going to church, working, and spending time with his family. Now the 27-year-old is paralyzed and bedridden from a mysterious illness. Who knows what it could be? We do know last year polio was starting to go around again, so who knows? If there's an update to this, I will provide it. Very strange and mysterious. Alright, moving on to this. Engineers frustrated with rails even as others get sick time. So this has to do with the BNSF Railroad. They are frustrated that they are not getting enough sick time as other railroads, like CSX, Norfolk Southern, are agreeing to pay their employees for sick time. Well, BNSF is still having a lack of sick time, and that is really concerning people, and it's really has them frustrated. I mean, it is 2023. This day and age, everyone should be entitled to a proper amount of sick time, especially since the pandemic. People, I guess the companies, corporations have not learned anything about how important it is to have sick time for the health and well-being of their employees. Forcing them to come to work sick, that's just totally ridiculous. All right, this day in COVID pandemic history. May 8th, 2020. The Associated Press reports that top White House officials blocked a CDC document guidance for implementing the Opening Up America Again framework that included detailed advice on how to safely reopen the country. FDA authorizes the first COVID-19 test with the option of using home-collected saliva samples. All right, taking a look at wastewater here. As you know here, all regions of the U.S. are either flat or dropping. The biggest drop is in the West Coast region. Taking a look at wastewater surveillance, you can see here not much has changed since yesterday's update. I do want to show you one thing, though, that's going to lead us into something else that I'm going to show you. And this is my area here in the southeast Pennsylvania. You can see here Montgomery County, 30,000 in this wastewater shed. It's flat at this time, and it's not rising. It's in low levels. Here's another one in Montgomery County that's in low levels. I wish I could show you Philadelphia County. I can't. Look at this one. It's actually dropping. Here's Bucks County. 55,000 people actually dropping. And I'm leading up to something here. And you can see here, here's Delaware County. And 6,800 in this wastewater population. Again, these are small sizes considering it's such a large area, but still, you're not seeing rising at any of these counties. And that's concerning because there's clearly something going on around here. And let's just skip ahead today, shall we? I mean, take a look here in Montgomery County. You can see respiratory emergency, respiratory emergency, respiratory emergency. Earlier, there were like 7 of them at once. We're seeing a lot of people getting sick. And remember, we've been talking about the EMS cases in Philadelphia County on Saturday. What was it? 811, I think it was. Well, look what we added yesterday. Yeah, another 802 EMS calls on Sunday yesterday. That's very high for a Sunday. Concerns me that if Sunday's that high, how high is today going to be? Because as you know, ERs, doctor's offices, places like that, one of the busiest days is usually on Monday morning. So let's see what happens today. I mean, there's clearly something else going around. Maybe it's a SARS-CoV-3. Maybe it's post-COVID effects. I don't know. And I do personally know of someone who just got sick once again in a senior facility. So, yes, there is definitely stuff going around right now, and it is just truly concerning. All right, moving on to the transmission map. 557 counties are in high transmission, 354 are substantial, 1,437 are in moderate, 775 are in low transmission. Taking a look at this, and you can see our variant proportion here, XBB.1.5 is the dominant variant at this time, 66.9%. Then comes the new XBB.1.16 at 12.5%, XBB.1.91 at 9.4%, XBB.1.92 at 3.7%, XBB.2.3 at 2.7%. All right, moving on to BNO's weekly update. They posted 78,518 cases were added. The average is 95,134. That's down by 10,554. States reporting 49 out of 50. In the hospital, 12,093 people. That is down by 1,272 patients. ICUs are also down 1,629, down by 154. New deaths are at 1,160 for last week. So that is down. And the average is also down as well. 1,307. That's down by 169. They are ending their weekly reporting simply because we don't know what's going to happen after May 11th, and a lot of states are not reporting daily anymore. So their reporting is just going to be weekly now. It's not going to be daily reporting anymore. New Jersey. Let's take a look at what's going on in New Jersey. Let's refresh this to make sure it is up to date. And in New Jersey, the latest number of cases is 78 cases added, probable cases at 38. And it says here just one death added in the last 24 hours. Hospitalizations are at 201. 11 people are on ventilators, and 29 people are in the ICU. Coming back to Pennsylvania, Center County, Pennsylvania, the only hospital in Center County, Pennsylvania, Mount Nittany Medical Center, and this is not good. You can see suddenly they went from 2 COVID hospitalizations on Friday to 4 on Saturday to 6 on Sunday. So they have tripled over the weekend. 6 is not a large number. We don't usually get terribly concerned until it gets to at or over 20 in Center County, but it is starting to rise again, so we'll have to see what happens. And as you know, there was a wastewater site up in Center County, the smaller one, where COVID prevalence was rapidly increasing. So it is something to watch. New York State, 327 new cases added. The positivity rate's 1.9%. The 7-day average is 1.8%. Hospitalizations in New York State are at 592, with 68 people in the ICU. Quickly taking a look at some international data here, and you will see on the international standpoint, South Korea added 16% increase in cases, 20% decrease in deaths. Japan, relatively flat on cases, 33% decrease in deaths. And coming down here, the Philippines added 233% increase in cases. They've also had 9 deaths in the last 7 days. Indonesia, 17% increase in cases, 64% increase in deaths. And coming down here, we also have Afghanistan, 116% increase in cases. They've also reported 6 deaths in the last 7 days. And taking a look here, Peru, cases are now down 63%, and deaths are down 81%. Alrighty, that does it for today's pandemic update. Remember, if you like this content, give it a thumbs up. If you want to see more content like this, hit the subscribe button down below. And again, do not take any shame in wearing a mask in public. It is very important to continue masking when you go into an indoor place, maybe even outdoors. Yeah, outdoors too. I mean, it works great for allergies. There's no reason to stop masking. Just because these numbers are lower, masks are good for all respiratory viruses. So continue to do so. I don't care what anyone says or think. Just do it. You do you. Don't worry about the other people. Okay? Alright. Thanks for watching this video. Have a great afternoon, everyone.